Hello and welcome to N1523. This screencast will review the reflective clinical notes that you will be submitting in week 7 and again at the end of the term. In order to access the documents to support you in this assignment, you will look to the left-hand side here and click on Reflective Clinical Notes. There will then be 4 documents that will provide you with support in performing this. The first one is an overview of this assignment. I recommend that you look at this overview and read it completely. I'll go over some of the things that are mentioned in this in order to prepare you to do this assignment. The second one is the clinical notes template. This is going to be the document that you're going to click on and you're going to open. It's going to open up, and this is going to be the document in which you will complete the clinical reflective note. Okay, so you will click on the different areas and you will enter the information. You will then save this with your first name, your last name, and then reflective clinical note for week 7 or midterm. Okay, you will put into the different areas in relation to your reflection. The other thing that you will see is the marking rubric. So take a look at that, as this is what your CPS will be looking at in terms of whether or not your reflective notes meets the requirements for satisfactory. The last document is a clinical note sample. It's a really good example of a reflective note that has been completed and would meet the requirements for satisfactory. So the purpose really of the reflective clinical note is it's an important strategy to support you in engaging in your clinical learning. It's going to help you to evaluate what you've been experiencing and explore your nursing experiences so that you can gain insight into the human responses to healthcare challenges and to look at promoting professional growth in yourself as a student nurse. So the goal of this reflective note is not really to list all of the many activities that you've been doing over the last few weeks, but rather it's to demonstrate your understanding of the situation that you've experienced, as well as what opportunities have presented themselves to yourself and that contribute to your professional and personal growth. When you complete these, you're going to be looking at a particular experience in your clinical setting, and you will also be going to the nursing literature to support your analysis and to extend and deepen your understanding of the situation that you encountered and the role of the nurse in that situation. When you submit your reflective clinical note, you will submit 1 copy to your CPS by email. As well, you will submit it to a Turnitin Dropbox, and you can see the Turnitin Dropbox below here. You will just click on submit, and that will submit it for you. Your CPS then will provide feedback about your clinical note, and if you do not receive a satisfactory on the note, it must be redone and resubmitted until a satisfactory is then achieved. In terms of what must be contained within your reflective clinical note, there's a minimum of 2 references that are required. One of these 2 references must be a peer-reviewed source. You're welcome to use more than 2, but at minimum you must have 2. When you are submitting and completing your note, it must be in APA format, and the reflection must be relevant to your current practicum experience and relate to the course outcomes for N1523. It must be your own reflection and writing, okay? And so the submission can be about something that was challenging, or an observation that you made about establishing this therapeutic relationship. It can be about something that relates to supporting a wellness-based care plan for an older adult. It can be a practice challenge in the clinical environment. It can be a caritas praxis observation that you've made. Any ethical challenges that you've encountered, or any sort of responses that you've seen related to a patient's family. Okay. So you're really looking to pick something that triggered a challenge or a learning gap, a question or a controversy for you that really made you reflect about and think about what you had encountered during your clinical day. When you complete the reflective model, you're going to do it according to Tanner's clinical judgment framework. Okay, and so you can see the aspects of his framework are talking about the situation or what you noticed, interpreting, responding, reflecting on action, and then a section for your references. So when you talk about and you're looking at the situation, you need to describe your relationship with the patient, the individual, or the situation at the time that triggered the event or the occurrence. What did you notice? How did you identify this as a major care concern? Consider describing your beliefs about your role as the nurse working within this situation, and what were any emotions that you may have encountered about the situation. In the interpreting section, think about what you were thinking about the situation, what caused it, what might be the potential resolutions. Were there any patterns in the way that people responded to the situation that you noticed? Describe any similar situations that you've encountered in your practice before. Have you had a similar experience? How was that handled? How did this experience then inform your response to the patient and how you dealt with that situation? Also, for the interpreting and assessing section, consider other information that you may wish to get about the situation. Was there other assessment data that you did in response to it, or is there any other information that you talked to the patient about in order to get a better understanding of the situation? Okay. And if you did collect more data, how did you obtain this data? Through assessment, through the family, through the patient themselves, from other staff on the unit maybe, or reviewing the patient's chart? Okay. Or did you go to the evidence-based literature to support you in understanding this situation further? So in this section, you really need to reflect upon what you did, what information you got, and how that helped you to understand the situation better. Okay, and consider, could you refine or improve the approaches or strategies that you use to fully engage the patient in addressing the care concern? Okay. And the other thing is to think about Watson's care processes. How did those help you to improve your caring approach with your client? For the responding in action, okay, what did your observations and data interprets lead you to believe with respect to the care goals in this situation? Okay, and within this, you need to include relevant biomedical and psychosocial spiritual information. Okay. Identify what were your specific care goals and how you responded at the time of the situation. Also, how did the concern influence your patient's health outcomes? Things like their quality of life, their independence, their sense of dignity, their mobility maybe, or their skin integrity, nutrition, pain, or safety. Right? So how did this really impact their ability to achieve overall health? And what are your patient's desires for their health outcomes and health concern? So what are their personal goals that they have in relation to wanting to move forward? And then in the last, sections, responding in action and on action, it's what did you do at the time of noticing? Were these actions evidence-based? Did you go to the literature? Do you know that what you did and your response is based on the best available evidence? What data, information, or assessments would indicate to you that your care made a difference to that patient? And this is really, those sections where you're going to be able to add and support your actions with the literature and the sources that you find. Okay. So again, a minimum of two articles or two sources of evidence. One must be at least peer-reviewed to learn more about the patient's care concern and supporting you and how you were able to act in response to the situation that you encountered. Okay. And really, reflecting on action, you're really looking at identifying from the research what additional knowledge, information, or skills you would then need when encountering the situation again or in the future. Okay. And describe any changes to your own values and your feelings that you've had as a result of this experience. And finally, consider how you can collaborate with other healthcare providers to strengthen your nursing care for this patient. So those are really the four sections that you're being asked to comment in relation to the situation. And then the last section is really for you to put in all of your references. There isn't a minimum or a maximum page number. I think the example will give you an idea of the quality and the richness that we're looking for in terms of a reflection. Okay, and you're going to be writing 2 of these over the term. So you're going to submit your first one at midterm in week 7, and your second one will be submitted towards week 10 and 11 at the end of term. And so again, you must receive a satisfactory on both of these reflective clinical notes, or you will be required to resubmit again. I hope that this really helps you to navigate where to find the resources to do this clinical note, and just helps to clarify some questions that you might have had in relation to it.